once again with Dr. Fink and Dr. Mazzarella at Gold Coast Orthopedic Spine and Hand Surgery. We're talking about what technique now on the wrist?
We're talking about wrist fractures, where we minimally invasive fix these fractures, we make a small incision, and this is outpatient surgery also.
So basically, outpatient surgery for the wrist. I know a few people have had wrist surgery, and it was really a lot, very intense. You would think just because it's on your hand, it's a lot easier, but there's a lot more bones in the wrist area, I would take it, or it's a lot more difficult anyway?
There are a lot more bones in the wrist area.
Okay, so basically you guys have someone's figured out a way to get in there without a cast and without opening the wrist up big.
We're now able to make a small incision, put the bones that are broken together like putting together a jigsaw puzzle, and we hold the bones with small plates and screws. We now have a picture to show to folks that do. And then afterwards, patients do not need a cast, so they're able to move their fingers quicker and avoid the problem of stiffness of the fingers.
Okay, so when they break their wrist, basically their fingers aren't moving the way they used to. Is that correct?
There are many different types of breaks of the wrist.
All right, well in this case, if this guy, the person that broke their wrist in this case, where was that break, on the inner or the outer part of the wrist?
That's not a question. They broke their wrist at the distal radius, and this patient has been fixed with plate and screws, and immediately after fixing this, they can move their fingers.
Oh, immediately after they can move their fingers. So when that is broken, they're basically without the use of their fingers.
Moving their fingers without it being fixed, they'd have pain in their fingers and their wrist, and they wouldn't be using their arm.
Right. So now let's bring it back, the camera back over to Dr. Fink. All right, we're going to talk about, that's the new way we know. We keep talking about this, we keep pushing this because I think it's a great thing, and I think most people out there will too. You know, downtime is much less, the pain is much less, the risk of infection is much less. Am I correct?
Correct.
And one other thing with this is there's no cast. How does that happen?
We fix the bones rigidly with this small lock plate and screw that does not require cast afterwards, which is better for the patient. They can regain their motion of their wrist and their fingers and going back to their daily activities.
Wow. So they basically come out with a scar and a pretty sore wrist, but they'll be able to start moving and get the blood flowing right after the surgery. And now we always talk about the new way, but let's go back to the old way. Let's talk about the old way of doing this exact surgery that we're doing right now on the X-ray.
The old way, before these small lock plates and screws, people would put external fixators. They look like tinker toys on the wrist, and they run the risk of pin tract infections. It's an awkward thing. You roll over in your sleep and you bang this tinker toys on your wrist.
So hold your wrist up and show us. They would be coming outside of your skin?
You have so you tinker toys on your wrist, an external fixator. It is occasionally used, but we've gotten away from this, where you have pins sticking through your skin.
Through your skin? Wow.
Yeah, and connecting it to what we call an external fixator. You would think tinker toys, and they run the risk of pin tract infections. This newer technique is a small incision, rigidly fixing these bones, allowing you to move your wrist and your fingers immediately.
So that, but plus, how long would you have to have that external, say, tinker toy on your arm, sticking outside of your arm?
6 to 8 weeks.
6 to 8 weeks. So let's compare. You know, the other one, you walk in, you walk out, you got a scar, and you can already use your hand. The other, you have metals and metal protruding from your skin, basically an open wound for 6 to 8 weeks.
Correct.
Wow. So basically, I think I'd rather get the other surgery. I think most people would too.
I think they will.
Yeah. So that's a great thing. Once again, we're with Dr. Fink at his office, Gold Coast Orthopedic Spine and Hand Surgery, talking about minimally invasive techniques. Thank you, Dr.